I think I'll also stand in front so I can see the PowerPoint. I want to thank Joe Bass for organizing this conference and for including this panel on health effects as part of it. I've had a long career as an environmental epidemiologist at UCLA, and I have a somewhat unusual background because my PhD is in elementary particle physics, so I understand both hard and soft science. And I'm also the president of the Scientific Integrity Institute, Los Angeles. And I'm going to go through these slides within the 15-minute time period, trying to make a strong case that fine particulate matter does not cause premature deaths. There may be a little more on the slides than I can talk about, but you can view them on the webcast. And I'll just go through this now. Basically, the major points I want to make are giving you some basic facts about PM2.5 and premature death claims, discussing the problems of the epidemiology upon which those claims are made, analyzing specifically one study, which has been the primary basis of the EPA standard for PM2.5. That's the American Cancer Society Cancer Prevention Study 2. And then I'm going to discuss my own independent analysis of that study, which was made possible during the past year. Then I'm going to discuss reasons why it's so difficult to change the existing status, because scientists and journalists and journals block the null results that I find and others find. And then finally, I'm going to call for a support of the kind of bills that Lamar Smith talked about at lunch today. Basically, here's how widespread the claim of PM2.5 premature deaths is. It's being used as a primary public health justification for the Clean Power Plan, which is supposed to be dealing with greenhouse gases. And when it was first introduced in 2014, you can see they're making a claim of 6,600 premature deaths. And they're saying basically that the premature deaths account for essentially all of the PM2.5 related co-benefits. Thankfully, President Trump is planning to rescind this by an executive order. And basically, here are some basic facts about PM2.5. It comes from combustion sources. Some examples are forest fires, exhaust from diesel engines, and in California, we're now getting up, on certain days, up to 30% of our fine particulate matter from China, which comes all the way across the Pacific Ocean. And the standard for PM2.5 was established in 1997 at 15 micrograms per cubic meter. It's been lowered to 12. And most of this has been based on secret science epidemiology, which is not the way to do science. The justification, this standard has been used to justify multi-billion-dollar programs across the country. They often go by names of state implementation plans, air quality management plans. In California, there's something known as the CARB truck and bus regulation. And as I mentioned, the EPA's Clean Power Plan. To give you a perspective on how much is involved in inhalation, I've done a rough calculation using basic facts about human breathing. And an adult inhales approximately 1 teaspoon of PM2.5 in an 80-year lifespan. That is approximately the amount that's in a bag of sugar that you put in your coffee. And it's not in the form of sugar granules, you can see. It's in terms of invisible particles that are less than 2.5 microns in diameter. This is also can be equated to inhaling about 100 cigarettes over a lifetime. These are trivial amounts when you understand the amount that humans breathe in their lifetime and the things they're exposed to. The benefits of PM2.5 are justified by two key assumptions that EPA makes. Again, first they assume that there are premature deaths, and then they assume that there's a $10 million value of statistical life associated with each of those deaths. I'm addressing the first claim. The second claim is something that involves environmental economics, but again, many of us consider to be wildly exaggerated. Here are what I've listed as, say, 6 top problems with the notion that there are PM2.5 related premature deaths. The first is that the data that these claims are based on has been secret for basically the entire time these studies have come out, certainly the major studies, and so you have no way of doing any independent reanalysis. The second is that there's no mechanism that's been proven whereby inhaling approximately 5 grams of PM2.5 over a lifetime could cause death. There needs to be some biological mechanism, and hasn't been specified. Since a lot of this depends on epidemiology, epidemiology is not capable of establishing causal relationships when the relative risks are tiny, as they are in this area of epidemiology. There are also, it's not justified to have one national standard when there's clear geographic variation and temporal variation in the risk of PM2.5 across the country, and yet we have one national standard. There are also other factors, including ecological fallacy, which means that the monitors that are used to determine the levels of PM2.5 do not reflect the fact that people spend most of their time indoors. And so their actual human exposure is much lower than what's reported by the monitors. And then there are other confounding variables that often aren't controlled, like other pollutants that exist concurrently with PM2.5. I'm going to discuss just one study today, and this is the primary study that EPA used to establish the PM2.5 NOx in 1997. It's the American Cancer Society Cancer Prevention Study 2, and it had approximately 99% of the available data at that point. There's a paper published in 1995. The key authors were Pope and Toon. And it did not use, I'm pointing out a couple flaws on this slide. It did not use the best available PM2.5 data, and the underlying American Cancer Society data has been kept secret. This was so controversial that there was a reanalysis done by the Health Effects Institute in Boston and this was published in 2000. This report was supposed to do a sensitivity analysis where they looked at other PM2.5 data and determine if the results held up. They did not do that sensitivity analysis using the best PM2.5 data. There was an extended follow-up that was done in 2009. This also did not use the best available PM2.5 data, and they did not address the issues that I and others had raised about their geographic variation that they reported in 2000. So because of a long history, mine goes back 44 years with the American Cancer Society, I was able to gain access to an old version of this data last year, and I have now got it in a peer-reviewed journal. The paper should come out online next week. And the title of it is Fine Particulate Matter and Total Mortality in Cancer Prevention Study Cohort Reanalysis. And this does use the best available PM2.5 data. This is the map that HEI published in 2000, 17 years ago, which shows clear geographic variation with actually a relatively low risk in California and the highest risk concentrated in the Ohio Valley. That's Indiana, Kentucky, Ohio, Pennsylvania, and West Virginia. And This is something I've asked them to provide more data on since 2002, 15 years ago, and they have refused to give me underlying data on how they prepared this map. So this is the summary of my basic findings, and what happens is if you use the data that they used, and this is the second line in red, you get an effect. This is an 8% effect, which is essentially what they found. But if you use the best available PM2.5 data, you don't get an effect. It's not significant. And the interesting thing is if you break this up into the Ohio Valley and the other 45 states, outside the Ohio Valley, there's not an effect using either set of data. And the effect when you adjust in the Ohio Valley, even though the numbers are above 1.0, they're not statistically significant. So it's very critical that the people answer these questions. Further confirmation that what I've done is correct is the fact the HEI people actually did a special analysis for California in 2010, and that's shown at the bottom of the slide, where they actually produced an inverse relationship in California. The relationship's approximately 0.9. But I find the exact same ratio. So this gives me an idea. This anomaly was reproduced when I did the analysis. So I believe I'm on to a very accurate analysis of the data. Here's another piece of evidence that supports no effect. And this is a paper that was published using a NIH AARP cohort that was designed primarily for cancer and diet, but it was publicly available, and it was published by Thurston last year. And you see the numbers here for the entire United States. They're both showing approximately a 2.5% increase that are not statistically significant. And then if you look in the California results, they're even smaller and consistent with no effect in California. And furthermore, this is evidence that's been accumulated since 2000 for 6 different cohorts, including mine in my paper I published in 2005, where they all are consistent with no effect. If you do a weighted average, you get exactly 1.00, and with very tight confidence intervals. And yet EPA will not recognize this data, neither will the investigators, the primary investigators in this field. Here's a couple, so that's basically the results. Here's a couple of the problems. And this is the prime author on the 1995 paper, Cleve Arden Pope III of BYU. He's an economist. He's self-proclaimed as the world's leading expert on the effects of air pollution on health. There's a number of key events. He cited my paper in 2006 when he did a review, but never again. And then we had a key teleconference in 2008 where I was on the phone with him and went over this in great detail. He's ignored everything we discussed in that conference. We were at a key meeting, which John Dunn was also at, in Sacramento in February of 2010, and we went through this in great detail. They ignored everything was discussed at that meeting. Pope ignored the subpoena that Lamar Smith issued on August 1st of 2013. There's a paper that was published coincidentally a month later by Genet and Pope that was on California, and they ignored their own results, null results. And he ignored an invitation I made to come to the conference here 2 years ago. And Michael Genet, the same kind of story. He is bounced around California, was at USC, UC Berkeley, and now is at UCLA. There have been a number of complaints filed about his work, and they are not addressed. The university just doesn't address the fact that he's admitting his null evidence. But we do have, and the ladies in the audience here from the U.S. Office of Research Integrity, they concluded that his paper in 2013 showed no effect. So I'm really thankful for that. The American Cancer Society has not cooperated, and now they don't have any excuses because the data is available, and that's what I've done here. But they need to be held accountable. Also, the Health Effects Institute needs to be held accountable because the key persons there, the president, Daniel Greenbaum, and their chief scientist, Aaron Cohen, have not been forthcoming in a number of these issues, and it's very important, since they're supposed to be a neutral broker, half funded by the EPA and half by the automobile industry, they need to be held accountable and address the issues that I've raised. I asked them, I told them about my new study 2 weeks ago, so we're now at 14 days, and they have not even responded to me. So this is not going to stop unless pressure's put on them. Basically, there's other problems with Science magazine. They're not publishing this, 4 rejections. And basically, I want to conclude by calling for support for the 2 bills that Lamar Smith talked about, the Honest Act, H.R. 1430, and the EPA Science Advisory Board Reform Act, 1431. And thank you very much.